doing?
Hi, my name is James Hopper. We're going to go ahead and continue. We have already done the IV insertion, and we've already hung our primary bag. The next thing we're going to do is we're going to hang our secondary bag with our Piggyback medication. We already have our bag of vancomycin here. We have a 50 milliliter bag to administer over 100 milliliters over an hour. So with that flow rate, we're going to go ahead and do 17 drops per minute because the line is a 10 drop per minute line. So the first thing we're going to do is we're going to come in, we're going to check our patient, check the site, make sure there's no heat, swelling, any edema, any leakage, making sure there's no complications that are going to hinder the medication getting to the patient. So everything seems all right. The primary line is going as it normally should. So we're going to go ahead and start to administer our Piggyback medication. So the first thing I'm going to do is I'm going to go ahead and take my line, make sure that everything's labeled properly, go ahead and label my tubing, and the next thing I'm going to do is I'm going to spike my bag. So the bag has been spiked. I'm going to go ahead and prime my line. Prime my drip chamber. Okay, my line is now primed. I'm going to recap my line. I'm going to go ahead and hang my bag. At this time, I'm going to lower the primary bag. Okay, now what I'm going to do is I'm going to go ahead and put on my gloves. Just let the patient know what's going on, the medication that he's getting for. Next, I'm going to take my alcohol wipe, and I'm going to clean the port on the primary tubing that I'm going to use for my infusion. Next, I would go ahead and clamp off the primary tubing, and then go ahead, hook my secondary tubing up, and then continue to unclamp that. Now that my secondary tubing is hooked up and unclamped, I would go ahead and establish the drip rate, which would be 17 drops per minute. Okay, now that that is set up, medication is now being administered to my patient. I'm going to go ahead and tell him the medication is now flowing. I'm going to go ahead and come back and check on him once the medication is done. So I would leave the room. I would come back once the medication is emptied, or he called me for any of his needs. I'm going to go ahead and assess the area, make sure that, again, there's no pain, swelling, edema, leakage, make sure that the patient got the medication delivered how it's supposed to. And I'm going to go ahead and clamp off my secondary tubing. I will disconnect it from the primary tubing. Gator clamp so that we can use this tubing later. Hang it, and then I would reestablish the drop factor of our primary bag, which before was 17 drops, so I would reestablish the 17 drop per minute. After that has been reestablished, I'm going to go ahead and dispose of all trash. Any sharps that I use, I would dispose in the sharps container. And then I would go ahead and leave the room and start my documentation. My documentation would include the medication for the MAR, the drug, the dose, the route, then my input for the amount of the diluted solution that I use for the input and output. And that is how you use a secondary Piggyback medication.